Hello everyone, welcome to Try Right. This is Pack 365, myself Srija. So today in this session, you're going to learn about the surgical procedures which are listed under integumentary system coding. So the first topic is skin replacement surgery. So what is skin replacement surgery? So skin replacement surgery is done when normal skin is lost or damaged due to burns, trauma or accidents, large wounds, infections, tumor removal, and the goal is to cover the wound and help to healing. So what are the components of the skin replacement surgery? Skin replacement surgery has two main steps. Surgical preparation, this means cleaning the wound, removing dead or infected tissue, preparing a healthy surface so the graft can survive. So CPT codes for preparation depend upon the area and size. So second is topical placement. So this is the actual placement of the skin or skin substitute on the wound. So there are two types. One is autograft. So the skin which is taken from the patient's own body. The best option because rejection risk is very low. And this autograft, it includes tissue culture autograft, nothing but the skin which is grown in a lab from patient cells. So the example is a skin taken from thigh and which is placed on burn wound on the arm. So second type is skin substitute graft, homograft, allograft and xenograft. So skin is not taken from the patient directly. So types is homograft or allograft is human donor skin, whereas xenograft comes under the animal skin which is usually taken from the pig. So this is often used as temporary coverage until the permanent grafting. So what are the coding rules and important guidelines? So office service rule. So if done in an office setting, so routine dressings are not billed separately. So they are included in the procedure. So next is measurement rule. So measurements, they are based upon the recipient area, the wound size but not the donor site size. So here the age-based measurement rules are age 10 years or below. So you have to use the percentage of the body surface area. Age over 10 years, you have to use square centimeter applied. So children is for percentage. For adults, it is in square centimeter. Wrist or ankle rule. So if graft involves wrist or ankle, you have to use a code that includes arm or leg, but not separate wrist or ankle code. So what are the special codes? Biological implant, CPT code 15777, which is used for biological materials placed to support the tissue. And supply of the skin substitute, CPT code range from 15271 to 15278. So these are used for application of the skin substitute grafts. So example from this slide is, the arm 250 square centimeter. You have to assign the code 15002 for the first 100 square centimeter and 15003 multiplied into 2 times for additional 100 square centimeter, as it is 250 square centimeter. So example 2, here neck is replaced of 330 square centimeter. So you have to assign two codes, one for primary and one for the additional, which is the remaining square centimeter. So surgical preparation. So the code ranges are from 15002 to 15005. So what is surgical preparation? The first component of the skin replacement surgery. So this surgical preparation, it means making a wound clean and healthy so that it is ready for skin graft, flap and skin substitute. So negative pressure wound therapy, wound VAC. So this includes removing of the dead tissue, cleaning infection, controlling bleeding, creating a viable wound bed. So it is an initial service which is done before placing grafts or flaps. So when not to use 15002 to 15005. So do not use these codes if only dead tissue is removed. So the wound is left open to heal on its own, which is a secondary intention. And in such cases, you have to use debridement codes, active wound management codes. So the key rule is surgical preparation is only for the wounds that will receive the further treatment. So now how to select the correct code? So based upon three things. One is location of the wound. So the codes group certain body areas together. Second is size of the wound in square centimeter. And third is for multiple wounds rule is, if multiple wounds are in the same code group, you have to sum the surface area of all the wounds. Same like debridement and excision. So what is the important coding rule here? You have to add the wound sizes only when the locations are grouped in the same code descriptor. So do not add the areas from unrelated code groups. So here's an example. So the scalp wound is 25 square centimeter and the face wound is 15 square centimeter. So both belong to same anatomical group. So you have to sum up and assign the code. Same as the second example, surgical preparation of wound from the trunk is 75 square centimeter and 75 square centimeter on the right thigh. So both are grouped under trunk and extremities. So you have to sum up the surface areas and you have to give a base code as well as an add-on code for the remaining square centimeter. And next is the second component, autograft. So what is an autograft? The skin taken from one part of the patient's own body and placed on another part of the same patient. Because it is a patient's own skin and the risk of rejection is very low. The CPT code ranges are from 15040 to 15261. So these codes include harvesting the skin, that is taking the skin from donor site and applying the skin graft to the wound. So you do not code harvesting separately if it is included in the graft code. Donor site repair rule. So if the donor site itself needs repair using skin graft and local flap, so that repair is coded separately. So simple closure of donor site is usually included. So how to choose the correct autograft code? So it depends upon three key factors: the type of autograft, split thickness, epidermal, dermal, tissue culture, that is full thickness, and tissue culture autograft. Second is location, based upon the location, whether it is a hand, foot, face, trunk or extremities. And third is size of the defect. So measured in square centimeter based upon the recipient side but not the donor side. So here is the general information. Split thickness skin graft, it includes epidermis and part of the dermis, so most commonly used. So it heals faster, whereas the donor side can heal on its own. So coming to full thickness skin graft, it includes epidermis and entire dermis. So it is better, it gives a better cosmetic result. It is used for face and hands and the donor side usually needs closure. Next is tissue culture autograft. So what happens in the tissue culture autograft? Patient skill cells are removed, grown in the laboratory, nothing but an incubator, and it is reapplied later. So this is used for large ones and also for extensive full thickness wounds. So these are the components of skin replacement surgery. So next is skin substitute graft. So what is a skin substitute graft? So it is a biological or synthetic material which is used to cover a wound instead of the patient's own skin. So it is commonly used in burns, large chronic wounds, diabetic ulcers, and when autograft is not possible immediately. So what are the types of skin substitute grafts? Allograft or homograft. So allograft or homograft, it is a skin from another human. Whereas xenograft, it is a skin from an animal, usually taken from the pig. So these grafts, they are often temporary and they protect the wound until healing or permanent grafting. So the CPT code ranges are from 15271 to 15278. It is a size-based coding. So if it is the wound less than 100 square centimeter, you have to assign first 25 square centimeter. The code is 15271 and for additional, you have to add 15272. If it is greater than 100 centimeter, you have to assign the code 15273. So it is different if it is less than 100, if it is different if it is greater than the 100. So supply of the skin substitute. So the material itself may be billed separately. So coded in the addition to CPT 15271 to 15278. So what are the general guidelines for the graft? So multiple wound rules. So add wound sizes only if they belong to same anatomic group. For example, trunk plus arms can be added. Face plus arm cannot be added. So what is included? Removal of the previous graft and simple wound cleaning. So do not bill these separately. So here is an example. 180 square centimeter wound on the leg. So for the first 100 square centimeter, you have to assign the code 15273 and for additional area, you have to assign 15274. And there's a large example here. A 55 years old male admitted to hospital with burns on trunk 140 square centimeter, arm 100, neck 70, face 60. So trunk plus arm. Trunk and arm belongs to same group. So combine the diameter. Whereas neck plus face, it comes under same group. So combine this diameter and code separately for each group. So you have to use greater than 100 square centimeter codes. So next is Mohs microscopic surgery. So what is Mohs microscopic surgery? So Mohs surgery is a special skin cancer surgery where cancer is removed layer by layer. So each layer is checked under a microscope immediately. So surgery continues until no cancer cells are left. So this helps to save the healthy skin and ensures complete cancer removal. So the term stage. So stage is nothing but it's a removal of one thin layer of a tissue. So each time the tissue is removed and examined, it's a one stage. A patient may need one or many stages. So think stage is nothing but one round of cutting plus checking. And second term is tissue blocks. So each removed stage is cut into smaller pieces. So these pieces are called as tissue blocks. So each stage can have one or more tissue blocks. So think stage is a pizza and block is a pizza slices. So how CPT codes work for Mohs microscopic surgery? So CPT codes for Mohs are based upon the anatomic location, stage number and as well as the number of tissue blocks. So CPT codes used for the first stage depends upon the body area like anatomic groups, head, neck, hands, feet, genitalia and also trunk, arms and legs. So the first stage you have to assign 17311 code for up to 5 blocks and first stage up to 5 blocks for 17312 for trunk, arms and legs. So only one first stage code is reported for anatomic group. And coming to add-on codes, additional stages up to 5 blocks each, 17313 and 17314. So this is used when cancer removes and another layer is removed. So additional tissue blocks, more than 5 blocks, you have to assign 17315. So this is used for extra block beyond the first 5 blocks of a stage. So this can be used for any stage. This is a very common exam trap. So CPT includes up to 5 tissue blocks per stage and anything more than 5 blocks, it must be assigned 17315 code. So here's an example. The head lesion, it has 3 stages total. So stage 1, we have 7 tissue blocks. So CPT includes only 5 blocks under 17311 and 2 are pending. So second stage is a 5 tissue blocks 17312 and third stage it's a 8 tissue blocks. So 17312 for the first 5 and 3 are pending. So here totally 5 are pending for additional blocks. So you have to assign 5 17315 codes. So the total answer is 17311 for the first stage, 17312 into 2 for the second and third stage and 17315 for additional blocks. And here is a picture of Mohs surgery. So you can see the visible lesion on the skin, how the first thin layer removed and layer by layer they are removing separately. So the final layer of cancer is removed at the fourth step. So this is how you have to code for Mohs surgery lesions. So next is burns. So what are burns? So how do you code burn? So the burn CPT code range is 16,000 to 16,030. So these codes are used for local treatment of the burn surface only, where dressing changes, topical application, minor debridement or curetment. So these codes do not include history, physical exam and medical decision making. So E&M services may be reported separately if documented. So what these codes cover? Cleaning the burn, removing the dead tissue, simple debridement, applying ointment and dressing changes. So they do not cover skin grafts, major surgical debridement and systemic patient evaluation. So how do you code a burn plus skin graft rule, which is very important. So when both debridement and skin graft are done, so what is the correct coding order? So debridement first. CPT code is 16,000 to 16,030. Then skin graft is for 1500 to 15650. So never skip the debridement code if it is documented. So don't use the burn codes for large surgical excisions and full operative debridement. So you have to use burn codes only for local surface treatment. Next is destruction of the pre-malignant, malignant and benign lesions. So these codes for destroying lesions depend upon whether the lesion is pre-malignant, benign or malignant and the number or size of the lesions removed. So destruction methods include freezing, nothing but a cryosurgery method, burning of the electrosurgery and chemical by treatments. So for pre-malignant lesion, you have to assign 17,000 code for the first lesion and for additional lesions you have to give 17,003 and 17,004. In the case of benign, for example, warts, seborrheic keratosis, up to 14 lesions you have to assign the code 17,110. For 15 or more lesions you have to assign the code 17,311. For malignant lesions, for example, basal cell carcinoma, anatomical location and size of the lesion. So this is based upon the anatomical and location and diameter. So these code ranges are from 17,260 to 17,286. So for example, pre-malignant lesions, there are 12 pre-malignant lesions. So you have to assign 17,000 for the first one and 17,003 into 11 times for the remaining 11 lesions. So if pre-malignant lesions are 16 in number, so as it is plus 415, as it is more than 15 lesions, you have to assign the code 17,004. So what are the breast biopsy coding guidelines? So when performing a breast biopsy using a needle, which is a skin approach, nothing but a percutaneous approach. So with imaging guidance, specific codes are used. So the imaging guidance, ultrasound, MRI or stereotactic is included in the primary biopsy codes and it is not billed separately. So for ultrasound guided lesion, for the first lesion, you have to assign the code 19083 and for the additional lesion, you have to assign the code 19085, which is an add-on code. So for a patient with two lesions in the same breast, biopsied using ultrasound, so you would use codes 19083 and 19084. So if the biopsies were in the opposite breast but use the same guidance, you would also use 19083 and 19084. So this guidance helped to ensure proper medical billing for procedures performed by dermatologists as well as other physicians. So next is code CPT code 19083. So this code is used for the first breast biopsy lesion which is performed using ultrasound guidance. So it also includes the placement of the localization devices such as clip, metallic palette. So coming to 19085, this is an add-on code which is used for each additional breast localization device or each additional lesion. So one lesion you have to use 19083 code. If there are two lesions, you have to assign both 19083 and 19084. If there are three lesions, you have to assign 19083 and 2 units of 19084. So you do not code for the ultrasound guidance separately because it is already included within the 19,083 code and 19,084 codes. So ultrasound guided breast cyst aspiration. So what does it mean? So for draining a breast cyst using a ultrasound guidance, you have to use the codes CPT range 19,000 for the first cyst and CPT 19001 for the each additional cyst. So these are used by medical professionals to report the services and procedures for billing and insurance purposes. So what are the localization devices? These are the small markers which are often placed in the breast during a biopsy to mark the exact location of the lesion for future reference or surgery. And what is a specimen imaging or a biopsy specimen? This is done to confirm the tissue sample taken actually contains the targeted abnormality. So what guidance is included for codes 19083 and 19084? So the ultrasound guidance, which is the code for 76942, which is in the radiology section. So it is already included in the 19,083 and 84 codes. So per lesion, not per breast. So billing is based upon the number of lesions biopsied with the same guidance, but not necessarily which breast they are in. For example, 2 lesions in the same breast or 1 in each breast using ultrasound. So it would still be coded as 19,083 and 19,084. So what is the difference between biopsy and aspiration? So a biopsy aims to collect the tissue for diagnosis, while an aspiration primarily aims to drain a fluid-filled cyst for symptom relief. This is about the ultrasound-guided breast cyst aspiration. So here are a few codes. CPT 19,000, the puncture aspiration of the cyst of the breast. So in aspiration, they are draining a fluid-filled cyst for symptoms. And 76942 for ultrasound guidance. So for imaging guidance, we assign generally 76942 and 77021. So this is a primary procedure which must be billed alongside an appropriate guidance code, which covers the physician supervision and interpretation of the imaging. So 76942 is allotted for ultrasonic guidance for needle placement, and 77021 is allotted for magnetic resonance guidance for needle placement, that is MRI guidance for needle placement. So you have to add on the codes. So both 19001 and the guidance codes 76942, 77021, these are always an add-on codes. So they are always listed after and addition to the primary procedure codes, that is 19,000 codes. So here is the ultrasound guided aspiration. For example, single cyst, you have to assign the code 19,000 for single cyst as well as 76942 for ultrasound guidance. In the case of 2 cysts, you have to add 19,000 for first cyst and 19,001 for second cyst and 76942 for ultrasound guidance. Same as in 3 cyst, 4 cyst and 5 cyst. If in the case of MRI, the guidance code will be changed. So this coding structure ensures that both the therapeutic procedure, draining the cyst, and a diagnostic guidance component using image for accuracy, these are properly documented for billing purposes. So now the aspiration procedures, that is 19,000, 19,001 and 77021. So these are likely for magnetic imaging guidance which are used during an aspiration procedure if applicable. So next is FNA, fine needle aspiration. So what is FNA? It is performed to obtain cell or fluid samples for diagnostic evaluation, that is biopsy intent, rather than just draining a cyst. So 10005 and 10006 codes, these are used when ultrasound guidance is required for the FNA. So code 10005 is for the first lesion and 10006 is for each additional lesion. Percutaneous biopsies with imaging guidance. So these procedures use a needle, often a cord biopsy or a vacuum assisted device to take a larger tissue sample for diagnosis and include the placement of a localization clip when performed. So 19081 to 19086. So these are the series of codes which is used for percutaneous biopsies with guidance. So 19081 for stereotactic, 19083 for ultrasound and 19085 for MRI guidance. So 19101, this is a code for open incisional biopsy, which is using a scalpel which involves a surgical incision to remove a part of the lesion. Whereas 19101, it is for percutaneous needle core biopsy without imaging guidance, for example on a palpable mass, and also clip placement. So if a localization clip is placed before an open biopsy to mark the area, so the clip placement can be built separately. So modifier 50, using of the modifier 50, which indicates a bilateral procedure. So this modifier is used to indicate that a procedure was performed on both sides of the body during the same session. So if it is applied to codes that are not inherently bilateral, so for open biopsies, you would report 1910150 for a bilateral open biopsy. So this is how you code ultrasound guided FNA and MRI guided FNA. So this is for today's session. I hope the session has helped you. So in the next session, you will be learning about the remaining procedures which are coded under integumentary system, that is a surgical procedures. Thank you.